Deep inside Tel Aviv's Sorovsky Medical Center, even the simple answers are hard to find.
It's something else. It's another disease that we are learning all the time, more and more about it.
This is an intensive care unit for COVID-19. The toughest coronavirus cases come here. Before we were allowed in, we had to dress like the medical staff for protection. My blood sugar monitor for type 1 diabetes required an extra wrapping. I've stood under rockets from Gaza, near artillery and sniper fire, and more. And yet a part of me is more nervous here. As we step inside, I meet Dr. Adi Nimrod, who shows us around the 16-bed unit. Most of the patients here are sedated, many on ventilators. Here, patients get individualized attention around the clock. The risk of anything less is too great. There is no set treatment for coronavirus.
You have to sense them and to see them every day, to check them, to see the faces, to see all the parameters. You know, there is the atmosphere around the patient.
An external control room allows remote monitoring of every bed and a place to breathe. Part of head nurse Iris Berman's job is to keep everyone positive.
It's very tough. Sometimes I'm not so positive, but I think if I won't be positive, no one will be.
One day at a time in there?
Yes, one hour at a time.
Within a few minutes of putting on all of his protective equipment and walking into the intensive care unit here, I started sweating. My mask, as you can see, I think fogged over. But I have the luxury of being able to take this off in a few minutes when I step outside. The doctors and the nurses will wear this hour after hour, treating the patients who need intensive care. They'll take a quick break, they'll step outside, and then they'll do it all over again. Israel's mortality rate has hovered around 1%, among the lowest in the world. Israel instituted restrictions on travel and public gatherings very early, and the country's healthcare system is among the most advanced, which has helped lower the mortality rate. But that number soars for the critical care patients who need to be ventilated, like many here. Sometimes the outcome is measured very differently.
You try, you do your best, you're just a doctor, just a human being, as they are. And if you cannot succeed, you can miss it.
Dr. Nimrod's treatment is guided by the latest science and also his experience. He was in the army during the 2006 Lebanon War. That's him treating the soldier on the stretcher. This, he says, is a different fight, one he calls much more complicated.
The virus taught us to be more modest, more humble, and a lot of compassion for the patients and families. And it's just a virus, but not just a virus. It's something much bigger.
The doctors and nurses are tested every week for the coronavirus. The hospital says everyone has so far tested negative. In this most sterile of environments, families are only allowed in if it's to say goodbye. Otherwise, messages are recorded and sent through the nurses, and prayers must penetrate the layers of protection around the ICU. The patients see only the unit's staff. There is solidarity here through a common vulnerability. The closer you get to the patient as a doctor, does that make it harder and more personal as a human?
It's also personal. We're human. We're fragile. They are. Now he's in this bed. Tomorrow I might be here. My family. I think they do. We're very fragile.
Oren Lieberman, CNN, Tel Aviv.